Hello, and welcome to the Niagara Region Public Health training video for the COVID-19 Pfizer-BioNTech vaccine. The purpose of this video is to share the knowledge and strategies that we have learned over the past month working with the Pfizer-BioNTech COVID-19 mRNA vaccine. Please note that this video is not meant to replace the complete training videos or training materials prepared by Pfizer-BioNTech. In this video, we will not highlight the information related to reconstitution, equalizing, and mixing the vaccine. We will, however, focus on the tips that we have learned related to withdrawing the 6th and sometimes 7th dose from the vial. Upon reconstitution, there is a total of 2.25 mL within the vial. In order to withdraw a 7th 0.3 mL dose, there is no room for any wastage or dripping. The vaccine nurse will need to access 2.1 mL of that fluid, leaving no margin for error. At the Niagara region, we are currently using a SureGuard 3 mL syringe with a 25 gauge needle, 5/8 inch length for reconstitution. For vaccine administration, we are currently using a Vantage Point 1 mL syringe with a 25 gauge needle with 1 inch length. This needle has very low dead volume, with the plunger fitting right up to the base of the needle with a very small barrel. For more information about low dead volume needles, please see the updated resource material recently provided by Pfizer-BioNTech to help with selecting the best type of syringe for administration. The success of accurately obtaining the 6th or 7th dose starts right from the reconstitution process. Please take your time when preparing the vaccine. You must move very slowly and methodically. We recommend that the professional preparing the vaccine is in a quiet and uninterrupted setting with no distractions. After preparing your workstation according to infection prevention and control principles, and ensuring your hands have been cleaned with alcohol-based hand rub according to policy, open an alcohol swab and clean the top of the 0.9% normal saline diluent. Allow the alcohol to dry before piercing the stopper with your 3 mL syringe. Once you enter the vial of normal saline, carefully and slowly invert the vial and withdraw exactly 1.8 mL. You must exercise caution when doing this as there is suction in this vial. Be sure to hold your plunger as you withdraw the needle from the rubber stopper to ensure that you don't lose any of the 1.8 mL volume. Clean the top of the Pfizer-BioNTech vaccine vial with alcohol and allow to dry. Pierce the rubber stopper to add the diluent to the vaccine. This must be done very slowly to avoid bubbles. About half of the diluent should be slowly depressed from the 3 mL syringe into the vial along the side of the glass. There is a lot of pressure and you will feel this in your fingertips. Allow that pressurized air to flow back into the syringe. Keep the vial lower than the syringe so gravity will keep the fluid closer to the needle tip. Gently add the rest of the diluent very slowly, being careful not to get any bubbling. With the syringe still above the vial and the bevel of your needle out of the fluid, gently and slowly withdraw the plunger to the 1.8 mL mark. Your syringe, now with 1.8 mL of air, can be taken out of the vaccine vial. Discard this syringe in your sharps. Invert the vaccine 10 times slowly and methodically so as not to get any bubbles in the vial. You are now ready to start withdrawing the 0.3 mL doses. Prior to each time you enter the vial, you must wipe the top with an alcohol swab and allow it to dry. Establish a pattern when entering the vial, being sure not to pierce the same section of the stopper twice, as this can lead to some vaccine wastage through dripping. Puncture the vaccine stopper with the vaccine vial on the table. Gently invert and draw up the 0.3 mL dose. Be sure that the bevel of your needle is in the fluid before you start to withdraw. It is also helpful to twist the plunger in your fingertips while you pull back. This decreases the air and helps any tiny bubbles to make their way to the needle tip. It is extremely important to draw up very slowly to avoid bubbles. You should never flick or tap the syringe to move a bubble. If you do happen to get a bubble in your syringe, gently pull back farther than the 0.3 mark and slowly move the plunger, twisting in your fingers to help force the bubble to the tip of the needle. Once it is at the tip, slowly push the plunger back to the 0.3 mark. Never withdraw your needle from the vaccine vial until your dose is perfectly at 0.3 mils with no air bubbles. Label the syringe and repeat this process. On your 6th and potentially 7th dose, insert your needle into a new spot on the rubber stopper close to the edge. Invert the vial and slowly rotate the vial in your non-dominant hand in an effort to collect all the tiny bits of vaccine from every area of the vial. You need all this fluid in one spot to have any hope of obtaining this extra dose. Tilt the vial on its side and position the bevel of the needle in the remaining fluid, where it is likely pooled beside the rim of the stopper. Very gently and very slowly, pull back to collect every drop. You may need to rotate the vial as you pull back, and you may need to push the fluid gently back in and re-rotate to collect a drop that is stuck on the side of the vial. Please note that accuracy is of utmost importance. You must never add more than 1.8 mils of diluent. Every dose must be exactly 0.3 mils with the vaccine right to the bevel of the needle. There are some times where that 7th dose is just shy of full, 0.28 or even 0.29 mils. You must discard this syringe immediately if it is not a full 0.3 mil dose. This process does take a lot of time and patience, but these extra doses are worth it to protect as many individuals as possible. In Niagara, using this process, we have had an almost 50% success rate in obtaining a 7th dose, thanks to the equipment that we have, as well as the patience, skill, and perseverance of the staff. It has been a learned skill and one that we hope to have shared well with you today. Stay positive and optimistic as we all work towards the common goal of providing immunization to as many people as possible to end this pandemic. Thank you.